Listen to this hospital note about the state of a nursing home resident in one of my legal cases. Now, I want to warn you first, if you have any compassion at all, this will break your heart. Here's the note. Nursing advised social services that patient arrived very dirty. It appeared the patient had little to no mouth care because patient had significant buildup in his mouth that came out in clumps. Also, patient had secretions from his trach that encrusted on his chest from shoulder to shoulder down to his mid-upper sternum. That is not only sad, it's infuriating. I was so angry when I read that note. I was angry at the nursing home employees who would allow another human being to get into that state. How do we get to the point when we allow another human being that we're supposed to be caring for to get into that kind of condition? Poor hygiene isn't just uncomfortable, it's dangerous, and it's a sign of neglect. And so let's examine why hygiene matters. Poor hygiene is the leading cause of infections in nursing homes. Residents who sit in soiled clothing, they develop UTIs. Unbrushed teeth leads to dental problems that can lead to infection and sepsis and even death. Unwashed skin can leave bacteria on the skin that can get into cuts and pressure sores, leading to infection and death. But let's also talk about human dignity. No one should have to sit in their own waste, smell their own urine, or have their hair matted and unwashed for days or weeks on end. Basic hygiene is about respecting their humanity. So, what do you look for during every visit? Body odor. If they smell clean or they have strong odor of urine, feces, or just body odor. Check their clothes. Are they clean? Look for urine or fecal stains. I want you to look at their skin, especially in the folds and the creases. Is it clean? Is it dry or red? Irritated. Irritated skin in the genital area or breast means that they're sitting in moisture for too long. Is their hair clean and combed? Or is it greasy, matted, or uncombed? Are their fingernails and toenails clean and trimmed? Or is there dirt under their nails? Are their teeth brushed? Or are they coated with buildup? So if you see any of these problems, speak to the director of nursing immediately and get those issues fixed. Poor hygiene isn't just unpleasant, it's potentially medical neglect. And if your loved one consistently shows signs of poor hygiene, document it with photos, videos, and dates. Report it to the facility administrator and follow up to make sure that the situation improves. If it doesn't improve and your loved one develops a serious injury or an infection, or dies as a result, you should report that issue to the state and also consider contacting an attorney in your area.